is a 15-year-old domestic shorthair who was recently diagnosed with cognitive dysfunction syndrome, or CDS. She lives in Sydney with her owner, Mr. John Payers, and here he is talking about the significant behavioral changes observed in Patches.
I've noticed quite a few changes in Patches over the past year. Look at her. She used to look so sleek and well groomed, but right now it seems like she can't be bothered with grooming herself. Look at her. Her hair is everywhere. So unlike a cat. And she used to be such an angel when it came to doing her business, but right now her business is everywhere. Also, I noticed her wandering about aimlessly at times, seemingly forgetting what she's doing. She just can't seem to keep her mind on things at the moment. Look at that, there she goes again. But one of the most annoying and irritating things that has changed is that she's now screeching all the time, early in the morning. It's like she changed from a cat to a rooster.
Meow.
The screeches are
Meow.
everywhere.
Meow. Meow.
In a recent review done by the university, scientists have found that signs and behaviors that used to be dismissed as old age could actually be attributed to cognitive dysfunction syndrome, or CDS for short. CDS is a widely recognized disease in dogs, but little research has been done in cats so far.
CDS is a neurodegenerative disorder that involves progressive cognitive decline and an increasing pathology of the brain. In dogs, the signs of CDS are summarized by an acronym we know as DISHA. DISHA stands for disorientation, alterations in interactions with owners and other pets in particular, sleep-wake cycles, house training, and lastly, activity levels. In our study, we utilized DISHA in an attempt to describe clinical signs in cats. And some of the clinical signs that we saw were very similar to the ones described in Patch's case, with things like excessive vocalization and house soiling. In our study as well, we compiled various data on other senior cats with behavioral problems. 83 of them were from referral clinics, and a further 100 were from the Veterinary Information Network.
Out of the 183 cats in the study, 87 had house soiling behaviours despite being previously house trained, and a large proportion of them also vocalized excessively, and disorientation and restlessness were also prevalent, and these are similar to signs of CDS seen in dogs. And these results give us a better idea of what to expect in CDS-affected cats. The most common sign in younger cats with CDS is a change in social interactions. Cats may become more distracted or exhibit signs of anxiety. Cats above 15 years of age generally vocalize excessively in addition to altered social interaction.
In another area, imaging studies have also identified some brain pathology related to OAH. These include things such as cerebral atrophy, increased ventricular size, as well as widening of the sulci. MRIs in aged cats also showed small multifocal areas of decreased signal intensity or scans that were predominantly in the peripheral lobe, and these appear to be associated with cognitive decline. A study of the cerebellum also identified a loss of neurons and a decrease in the amount of dendrites in Purkinje cells, which may result in a decline in information processing and motor deficits in the animal. Amyloid beta accumulations within the cerebral blood vessels and the microhemorrhages in the periventricular vessels could also be responsible for some of the clinical signs that we see in cognitive dysfunction. This is because a link has been established between amyloid beta accumulations in Alzheimer's disease, particularly in dogs and humans. However, we will need to do more research before a link in cats can be conclusively proven. Another observation that we see in aged cats is a marked atrophy of the cholinergic system, which in a place called the locus coeruleus. This may lead to signs of cognitive dysfunction and alterations in REM sleep in particular. With increasing age, there's also an increase in oxidative damage to the cells, and this occurs in all species, including dogs and humans. And it's also speculated to be of significance in aged cats as a result.
To date, there has been few published literature on aged cats and related brain pathology, with rather inconsistent results. Eye blink conditioning deficits have been looked at in aged cats, since it has been found to be significant in aging humans and Alzheimer's patients. Results from various studies have been inconsistent. One should note, though, that the methodology of the studies compared had certain flaws which could have made for inconsistent results. As for neurophysiological testing, a new test apparatus has been developed by Kencock Technologies, and while work is still underway, initial data strongly support the existence of CDS in cats, and it will be a promising tool in finding out the link between brain pathology and age-related cognitive decline in cats, as well as in developing techniques to manage feline CDS.
This paper has been brought to my attention recently, and I certainly hope this sparks further research regarding CDS in cats. I just really want to know more about what's happening with my poor cat patches, and hope that there will be a solution for us and others in the same predicament.
Critics have lauded this paper as having reasonable conclusions. Results from the other species have been summarized as a basis of comparison to the study done by the authors themselves. However, more in-depth research needs to be done over a wider range of subjects to properly quantify the spread of this condition and come up with a definite way to identify and characterize the symptoms of CDS in cats. Also, since the conclusions were mostly extrapolated from research done in humans and dogs, results will be far more reliable once the studies are done to shed light on the condition specifically in cats. This paper, along with its checklist of signs and symptoms, will allow vets to more accurately diagnose this condition in cats. Animal owners may no longer dismiss such signs and symptoms as just old age, but rather a condition that can be managed. New methods of managing this condition includes dietary supplements or behavioral modification that can help in situations such as patches. It is the hope of the authors that further research will help both cats and their owners lead more successful and fulfilling lives. Erica Chan, signing off.
Meow.